There are two important aspects to remember once you've had your teeth extracted: the health of your dentures and the health of your gums. Maintenance can vary based on the material your denture is made of and if you have any teeth remaining. Additionally, implant retained dentures will require a different cleaning method. Full acrylic dentures are the most straightforward to clean and care for. Remove after every meal and brush with a soft bristled brush and denture-specific, low-abrasive toothpaste or cream. Keep in mind that dentures are made of acrylic. The plastic is resilient, but exposure to hard scrubbing and abrasive toothpaste can weaken the material. Stimudent Fresh and Bright is ADA-approved toothpaste. Dr. B Dental Solutions is another good brand that is also ADA-approved. The Clean-A-Dent paste is well-reviewed. It is also important to ensure your dentures do not dry out. Never leave them exposed to direct sunlight or out in the air for too long. You should store your dentures in water at night while you sleep. Depending on the hardness of your water, it would be best to use distilled water, as there will be no minerals that may react with the acrylic. If you use a denture cleaning solution, be sure to follow the instructions as to how long to leave your dentures submerged. There are denture-specific storing solutions available, but not all cleaners are meant to be used to store your dentures. Some cleaners will begin weakening the acrylic if left submerged for too long. Clean your gums with a soft bristled brush or a damp washcloth. Remove any leftover food, and if you use a dental adhesive, take extra care that all excess is removed before going to sleep. Partial dentures require a similar maintenance regimen. Don't forget to clean your natural teeth. Using a mouthwash high in fluoride should help maintain the health and strength of your remaining teeth. If you have a metal frame for your partial, then be sure to store in distilled water at night. A lot of cities have chlorine added to their tap water. Although the amount of chlorine added to the water supply is minimal and safe to use, it will react with the metal and cause oxidation over time. Likewise, some well water sources may contain certain minerals that can react with the metal. Never store your dentures in salt water, whether that be for full acrylic or partial metal frame dentures. Adding salt in as abrasive might help to get them clean in the short term, but it will ultimately hurt their strength in the long run. Salt water is especially corrosive to metal. If you have snap-on dentures, clean them in the same fashion as you would a full denture. Pay close attention to the implant housing units set inside of your acrylic denture. It is of utmost importance that you clean around your implants thoroughly. Use a soft bristled brush to remove any buildup of plaque. Any buildup of plaque can cause inflammation and periodontal disease at your gums around your implant. As the disease progresses, it will eat away at your gums and further expose your implant. This can cause serious issues and even cause your implants to fail, requiring for them to be removed. The most time-consuming type of denture to clean and maintain is a screw-retained implant denture. These dentures are removable by the dentist, but not removable by the patient. Patients are at risk of neglecting the health of their implants as they are more inaccessible. Use an angled, soft-bristled interproximal brush to help reach under the denture. You should also look into getting a floss threader. It looks like a big plastic sewing needle. It helps get the floss under the dentures so you can clean your gums and remove any plaque from around the implant. Use an antibacterial mouthwash, preferably one high in fluoride. ACT is the brand highest in fluoride. If you have an acrylic screw-retained denture, then all of those things still apply, except you will want to use a toothpaste made for dentures. As previously mentioned, abrasive toothpaste will wear your acrylic denture down and make it more susceptible to staining and breaking. Denture maintenance is a necessary part of owning a denture. Having good oral hygiene will go a long way into preserving both your denture and the strength of your jawbone. See your dentist if your denture begins to fit poorly, and be sure to continue to go for checkups twice a year.